Hi, good evening. I'm Sandeep, and you're watching The Weekender at 5. In today's show, we are delving into a very important issue affecting each one of us and the entire New Zealand. From starting from today, 15th of February, tonight, on Tuesday, New Zealand will be entering into the second phase of public health response to Omicron. The government has activated the second stage starting from tonight, as was announced by Prime Minister Jacinda Ardern yesterday. So we will try to understand and revisit and analyze different aspects of what it means and how this second phase of public health response to Omicron will be affecting each one of us. So the first thing first, the basics. I'm pretty sure that you all would be aware by now what exactly this phase two will look like. In phase two, the objective is to slow down the spread of Omicron, which is a very highly transmissible variant of COVID-19, into our vulnerable communities. So government has, from very beginning of handling this Omicron outbreak, has decided or has laid out three-stage plan: phase one, phase two, and phase three. And government has announced on 26th of January earlier that as soon as New Zealand reaches to a stage where they would be seeing around 1,000 cases every day, they will be activating the phase two plan, which was announced yesterday by Prime Minister Jacinda Ardern after record 981 cases. Today, it was followed by another 744 cases, and the decline that might appear is not real. There is a huge demand on the testing centers, and there is a delay in the reports coming up. So a lot of experts and a lot of people out there in community, they are very clear that we are already in the numbers of 1,000 every day, making it quite necessary for government to move to the next stage. So what we are aiming today is to briefly touch what this phase two of public health response to Omicron means. What are the basic changes? What it means for you? And more importantly, we will be trying to understand that how this phase two will be affecting, or how does it is affecting to different segments of our broader Kiwi Indian community and the New Zealand. So first thing first, we all know that the basic difference of being into phase two of public health response of Omicron is that the reduction of the self-isolation period for cases. So as we know that right now under phase two, which is still today, any person affected by COVID-19 virus has to go off 14-day self-isolation period. And same with any household contact or close contact of a COVID-19 infected person has to put themselves into a 10-day self-isolation and get a negative test to come out of that self-isolation. So the major change that is happening from phase two, that is starting from tomorrow, is that the isolation period, the self-isolation period has been reduced to 10 days for somebody who is infected. And for anybody who is considered close contact, the self-isolation period is reduced to 7 days. So what it means on the onset, it does mean that why the question may arise that why the government is dealing with this spread of Omicron variant, which is considered highly transmissible, by reducing the number of days in terms of self-isolation. So the most apt answer for that is that the way Omicron variant has been spreading all around the world, it has become extremely difficult for governments to control its spread. And there is a sense of givenness. We have heard from leaders from other countries overseas, including in Australia. As you may recall, a couple of months ago, when a prominent leader from Australian government has said that they have already conceded the fact that everyone in Australia at one stage will be affected by Omicron. So that kind of thought is already being reflected here in New Zealand as well. The only difference is that New Zealand's government has tried to control the spread of Omicron virus here in New Zealand and buy some time and use that time to get booster vaccination rate up in the community. But yes, they have that kind of clarity that at one stage everyone in New Zealand would be affected by this spread of Omicron virus. So what it means that the spread of virus is imminent. Everyone would be having at some stage, but going by the records overseas, going by the data collected overseas, Omicron variant is not that deadly or lethal as was the Delta variant. So it is expected that by reducing the number of days of self-isolation, probably that will be the best medical response as well. But more importantly, that will be best economic response, as it will be giving opportunity for workers to return back into workforce and as soon as they can. So we will come back and talk more about this particular issue because this issue is affecting a lot of businesses, particularly small businesses all around the country, and it is creating a very anxious, unease, calm in the manner in which government is responding to this Omicron spread in the community. So after one individual has self-isolated from 10 days and the one who is in a close contact has isolated for 7 days, household contacts will be actively managed by the contact tracing services. And the close contacts will be requiring a PCR test on day 5. So after having a PCR test, only the person would be allowed to come out of those self-isolation. But anyways, coming back to the broad medical response that the government is aiming to shift the medical response, shifting the responsibility of managing the health for most of the community while using the health system, the medical system, to provide a targeted help or targeted care to those who are more vulnerable or more in ICUs requiring urgent interventions. So that's the guidance. The government is expecting a rapid escalation in the case numbers and resulting in the pressure on health system, and therefore will now be requiring to shift from identifying all infected individuals to being more targeted to those who are most at risk and those needed to keep the country going. So what it means that government will be using digital technology, as you all would be aware by now. In this digital technology, what it means that instead of getting more frequent phone calls and phone interviews from the contact tracing team or from Ministry of Health team, talking more about the health updates, probably the cases will be notified now going forward in text messages and be directed to an online self-investigation tool, which will be focusing on high risk exposures. And information about the test results and any other medical advice will be provided by email and phone based interviews. They will be restricted basically based on urgency or the level of sickness of the people who are involved. Other important change in this phase 2 is that testing requirements will be changed, that there will be a change in the current testing environment for critical workers who are close contact of cases. There is a government has brought in some regulations around testing for critical workers and for testing who are beyond or out of the scope of critical workers. This issue is again affecting a lot of businesses, small businesses in particular. We will talk a bit later more about this. But the primary focus, the way the government is looking at that, the primary focus of testing and tracing is now to protect the workforce, that is the critical workforce, and those most vulnerable to become severely unwell. So what it means that if you are not a critical health worker or if you are not one of those who are vulnerable medically and health-wise, then probably you would be expected to manage your health conditions on your own by self-isolating, getting some medicines, Panadols. That information is quite available everywhere in media, on government health's website, on Indian Weekender's articles as well. You can keep on updated yourself. And the other important thing about this phase 2 that we are talking about is more rapid antigen testing, RATs as they are called, in the community. I'm pretty sure that you all would be hearing a lot about rapid antigen testing. There is a lot of debate going on. Previously, government was averse to the idea of getting RATs test in the community for the sole reason that Rats, the efficacy of or the accuracy of rats test is always considered to be less than the current RT-PCR test that New Zealand government is following. So, but still, in the phase two, as Omicron spread gets wider, government has allowed rapid antigen testing. So they will be seeing more widespread use of test, and that is particularly at the part of their return to work policy. Again, this is an important thing that we will touch base in the later part of this program, which will be linked to all those three things related to small businesses and critical workforces that we have been talking all along till now. So, what the government is saying that the government will be continuing to manage the testing of symptomatic people and close contacts with PCR testing, but they will be enabling tests to return for asymptomatic critical workers who are close contacts of cases using the rapid antigen testing. So these are the people, say, who are in the healthcare system, frontline staff working in food supply, infrastructure, who are basically considered as key to the response to COVID-19, and also to ensure that New Zealanders can continue access to basic essential services. So, well, that's so. Those are going to be the major changes that we are going to see in the phase two of this response, which will be activated from tonight, 11:59 p.m. on 15th of February, Tuesday. Starting tomorrow, we will be in that phase two response area. So that's the basic information about phase two public health response for Omicron scare. That leads us to an important question that what exactly it means. What does it mean to an ordinary Kiwi, to an ordinary New Zealander or a Kiwi Indian community? And what does it mean for small businesses, big businesses, the workforce, and why there is so much of anxiety in various media reporting on this particular issue? Why we are hearing so much of concerns coming from different corners of businesses, left, right, center, and so we will try to explain a little bit more on that. So first thing first, what does this phase two response mean? Like, if you are an ordinary New Zealander and you have the ability to work from home, then for you probably nothing changes except your level of curiosity would be more far now with seeing such record high numbers coming every day. Apart from that, probably there won't be much change to your personal situation. You still will have the ability to work from home. Your work will be not affected. You will be getting paid, and you hopefully by staying home and going to selective places, doing the contact tracing, doing the QR coding and keeping a track record of where you're going and following the best health practices, including masks and maintaining a social distancing, you will be able to ensure that you are safe. So for you, probably nothing changes. It's more like a news, except you are worried more about safety of your loved ones around you and how things are unfolding in this phase two of this public health response. But that may not be the case if you don't have the ability to work from home, which is a harsh reality for a vast number of workers here in New Zealand who still don't have the ability, or the nature of their work doesn't allow them to stay at home and work. Say, for example, restaurants and hospitality industry. So they still have to go out and do the work to be able to earn a livelihood. That sector is anyway suffering a lot. We will talk more about that a bit later. But coming back and talking more in general about the workers and the businesses, as we all have noted that there is a lot of media reporting, a lot of anxiety out there. We are hearing from different business segments, particularly around rapid antigen testing and the self-isolation period. So what is the source of that anxiety? Why that anxiety is out there? The reason being that with the level of high transmissibility of this Omicron virus, which will be at one stage is believed to affect most of the Kiwis, if not to our vulnerable communities and the vulnerable people, then what it means that if everyone is affected, or if somebody is a close contact of being affected, then by law you are required to self isolate. So maybe for 10 to 7 days, which can have significant impact on different businesses. Imagine that in a business of, say, mid-sized business of 20 odd people, 30 odd people, if 5 to 10 people they are not available to work for 7 to 10 odd working days, they don't have the capacity to work work online remotely and contribute to business revenue, then obviously it will be significantly impacting the business's ability to make money and to deliver services and to remain viable. And that explains that a lot of businesses, they have been in a missionary zeal to buy those rapid antigen testing. We have been hearing those stories for quite some time. There has been a tussle between businesses and the government. A couple of weeks ago, when we heard the stories that government has sourced or scorched all the businesses' order for rapid antigen testing, so that government can use those rapid antigen testing and spread out to kiwis to do the testings. So businesses were actually wanting to get those rapid antigen testing, particularly the big businesses, particularly the businesses who are more into critical workforce, to be able to remain viable by having the ability of those tests for their employees, who can test every day or maybe once in a week and still be able to come and work, so that work is not affected, so that business is not affected, livelihoods not affected, and things can go on as much possible in a normal fashion. But what's happening is that to support that certainty, and what government has done, government has created a critical uh, a, a list or a category of critical workforce or critical businesses, and they have enlisted around 5,600 businesses in that particular critical sector, where government will be providing rapid antigen test to those businesses and those workforces. So what it means that if we are looking at a rapid antigen test, which may cost around 6.597 to around $10. So those tests will be bought by government and would be made available free of charge to those 5,600 odd businesses and their employees. So it's a good thing. They will have the extra ability, they will have the extra capability of ensuring that their workforce are timely tested and they are able to turn up to their workforce on a daily basis and keep the businesses up and running. What it means certainty. It means definitely a certain pathway that businesses can follow. Well, all is well with that, but the problem is, and that is the biggest problem, that there is a vast number of small businesses in New Zealand. As you all know, that New Zealand's economy is primarily a small businesses based economy, and a predominant large number of small businesses does not qualify for coming under government's defined, or shall I say ill-defined, uh, list of critical work, the critical work sector. And it is just like, a small greengrocer, or maybe like a restaurant or a cafe. Hospitality sector is definitely suffering a lot because they are not being considered as a critical workforce. And what it means that if there is a small restaurant, small cafe with around 3 to 4 staff, and a couple of their staff, they are sharing flats, and somebody in that flat was at a place of location of interest, or has got COVID infection, or has been asked by health authorities to go for self isolation. So what it means that those 2 staff out of the 3 staff of a cafe or restaurant, or maybe 4 staff, they will also be forced to do self isolation because they don't have the ability to use rapid antigen testing, that is RATS test, for as a part of return to work policy. So it means that that cafe or that restaurant is quite likely to either shut down and yes, and shut down till they can. And that explains that yesterday, immediately after Prime Minister's announcement and explanation on how this phase two of public health response of Omicron will look like, there have been reports that there would be around 30, 40 odd restaurants who have already closed their doors. There are media reports coming up from Queenstown, which is hub of our local tourism, that within a week's time, probably all hospitality venues might have to close down. And this is all happening when there is no support available to them. Government has still not responded to an advocacy by hospitality industry of providing targeted support, such as resurgence support to the hospitality sector, who would be embracing a full-blown spread of Omicron virus in this phase two, and will have neither the luxury of using rapid antigen testing and return to work to ensure their workers come back and work. Plus, they won't have luxury of any support from the government. So that's not just about hospitality and restaurant and cafe. It's about many of our small businesses in the community. And we all know that most of our small businesses in the community, they might not have access to that kind of specialized knowledge and information as is available to mid-size or big-size businesses who are working hard to future-proof their businesses by ordering rapid antigen testing in advance to ensure that their large workforces, maybe around 50 to 100, they have the ability to report a negative test and turn up to their workplace every day. Within small businesses environment, most of the time, which are mom and dad owned small businesses, they don't have access to that kind of specialized knowledge, specialized information, timely information at one point, and they are just acting as if they are moving in the dark and taking one day at a time. So that explains that why there is so much of anxiety out there, particularly within the small businesses community, that how the next few days or possibly weeks within this phase two of public health response to Omicron spread will be unfolding. And yes, that's all for today. I think we have covered a lot of ground today. There is a lot of information. Indian Weekender will keep on probing the issue, keep on analyzing issues, and bring on our various platforms, be it print or digital or web. Do follow us on our social media and our website, and we will continue to bring more on this phase two developments. Thank you very much.